Hi, I'm Dr. Abrar Hussain, a psychiatrist based in Berkshire. In this video, I want to talk to you about PTSD and complex PTSD, what they are, how they show up, and how we can begin to heal from them. PTSD stands for post traumatic stress disorder. It can develop after someone experiences something that feels threatening, overwhelming, or terrifying, whether it's emotional or physical. There's also complex PTSD, which often arises from long term or repeated trauma, especially during childhood. This might include emotional neglect, abuse, or growing up in an unsafe environment. People often think that trauma has to be extreme or dramatic, but trauma can actually be both a big T trauma and a small t trauma. Big T traumas are accidents, assaults, and natural disasters, whereas small t traumas are things like repeated emotional invalidation, bullying, and abandonment. What defines trauma isn't just what happened, it's how the nervous system responded to the event and our own response to the trauma. Trauma happens when something overwhelms your ability to cope, process, or feel safe. PTSD is the brain's way of staying on guard after the danger, and your nervous system doesn't realize that the event is over. The common symptoms of PTSD include flashbacks, nightmares, intrusive memories, avoidance of any reminders, hypervigilance, emotional numbness, irritability, feeling on edge all the time, sleep problems, and feeling disconnected or shut down. In contrast, in complex PTSD, along with all the PTSD symptoms, people often experience a deep sense of shame or guilt, chronic low self esteem, difficulty in regulating the emotions, and interpersonal difficulties. Sometimes trauma is very well hidden, even from the person who experienced trauma, and they might come and see me for anxiety or depression or just overwhelmed without realizing that it all links back to trauma. Some people also manage their symptoms in ways they know how to manage, for example, using alcohol, food, overworking, or avoiding the traumatic reminders. These strategies work in short term to bring relief, but in long term, they are unhelpful and they're damaging. The behaviors often make sense in context, and they're not weaknesses, they are adaptive strategies to survive the trauma experience. The good news is that PTSD and complex PTSD are treatable. With the right support, people can begin to feel safe again in their bodies, minds, and relationships. Once PTSD or complex PTSD is diagnosed, the next step is planning treatment. There is a role for medication, and there are also evidence based therapies that can help to process the trauma and come to terms with what happened. Recovery from PTSD and complex PTSD isn't about erasing the past, it's about understanding what happened, processing the impact, and learning how to live more freely in the present. If you've been struggling and nothing seems to explain why, trauma might be playing a part. You're not broken, you're just in survival mode. With the right support, you can move from surviving to living. Thank you for watching.